Good afternoon, Durham. I'm Dr. Rod Jenkins, Director of the Durham County Department of Public Health. It's been a while since I last addressed you in one of these video messages, but today I want to talk about a timely and a very important topic, and that's measles. If you don't remember hearing much about measles prior to this year or last, that's because measles was previously declared eliminated in the United States thanks to the effectiveness of measles vaccines, also known as MMR vaccines. Unfortunately, due to decreases in vaccination rates in recent years, already just under 5 months into this year, we've seen more than 800 cases of measles. That's nearly 3 times the total number of cases seen throughout the country in all of 2024. This outbreak was completely preventable. The measles vaccine is highly effective. Receiving both doses is more than 97% effective at preventing measles, one of the most contagious illnesses on earth. About 9 out of 10 people who come in contact with a person with measles will also be infected if they are not protected by vaccines or previous infection, and it can spread throughout the air for up to 2 hours after an infected person has left the room. Vaccines can keep you safe. In the current outbreak, 96% of people who have become infected were unvaccinated or did not know their vaccination status. Only 2% of people infected so far had received both doses of vaccine. Make no mistake, if you plan to be near other people, vaccines are the only safe and effective way to prevent measles. It cannot be prevented by vitamins, healthy eating, exercise, or other home remedies. Vaccines are critical to protecting yourself and your family. So why have vaccination rates decreased? Unfortunately, we have seen increases in the spread of misinformation, making some parents concerned about vaccinating their children. The facts have not changed. Measles vaccines have been around for more than 50 years and are still very safe. These vaccines have saved lives and will continue to do so, but only if you get yourselves and your children vaccinated. Measles is not just a rash. It can be very dangerous, especially for young children and people who are pregnant. About 1 in 5 unvaccinated people in the U.S. who get measles is hospitalized, and as many as 1 out of every 20 children with measles get pneumonia, the most common cause of death from measles in young children. At least 2 children and 1 adult have died from measles in the current outbreak, and it's likely this number is actually higher. Measles can also cause lifelong health effects like brain swelling that leads to deafness and intellectual disabilities, or a condition known as SSPE, which develops years after measles infection and is almost always fatal. Don't risk your child's life against a highly preventable but very dangerous illness. Misinformation is spreading, but the facts have not changed. Measles vaccines are safe, effective, and can save the life of your family and others. Although no cases have been confirmed in North Carolina yet this year, don't wait until it may be too late. If you and your kids have not been vaccinated, the time to vaccinate is now. If you were vaccinated before 1968, you received a previous version of the measles vaccine that is less effective, and you should talk to your doctor to see if you should be vaccinated again. Vaccines are available at most primary care providers and here in our immunization clinic. Call us at 919-560-7608 to schedule. Don't let misinformation get you or your family sick or even killed. By getting the facts and getting the vaccines, I know that we can do this, Durham.